Hi, I'm Dr. Cameron Keeney with the Center for Sleep Apnea and TMJ. So, sleep apnea can affect anybody, adults or kids. So one of the questions I get often is, how do we fix sleep apnea in kids? And when I say kids, that would be anybody under the age of 18. There are a couple of different ways to treat sleep apnea in kids. Usually the most common way would be taking out the tonsils and the adenoids. As we do that, that tends to open up the airway properly so that the person can sleep better and have a more open airway. If that doesn't tend to work, then the next best option is what's called maxillary expansion. Basically what that is you work with an orthodontist to open up the palate so that the mouth has more room for the tongue. As that happens, the airway can get bigger as the child develops, and the sleep apnea tends to take care of itself. If the child is not a good candidate for maxillary expansion, then unfortunately the other options would be something more traditional that an adult would do, such as CPAP, a CPAP machine, or an oral appliance. Now unfortunately, as a child is developing, we don't necessarily want to put a CPAP or a dental appliance on, because that can kind of mess up their development a little bit in the mid-face region. Unfortunately, the problem is sleep apnea can also mess up their development along with their brain, their body. So it becomes a question on, how bad are the side effects of the sleep apnea versus the treatment for sleep apnea going to be. So we have different options in how we can treat youth. Usually the best is again, tonsils and adenoids coming out, and then the next best would be getting maxillary expansion with orthodontics, and then if that doesn't work, again, more traditional type therapies would be the next best option. If you'd like to learn more about this, please visit our website, www.sleepidaho.com, or feel free to call us at 208-376-3600.